so glad to see such a good crowd on a Tuesday afternoon at 2 o'clock when it's nap time. But just for the next couple minutes, concentrate, because you're going to have to answer this question. You know I love this. Okay, we have the three wonderful nurse practitioners here. Kathy, Ann, and who's the other one?
Mindy.
Mindy doesn't spend as much time in the clinic, and so I wanted to make sure that you understand she's not vacationing. She's at the Arbor, and she helps them and doubles at the clinic. So I'm glad you all knew her. I asked for them this morning to tell me something about them that you guys would not know. Now, not necessarily a secret, but their other life. So I'm going to read 3 things, and then you will all have to vote on which one goes with which person. So pay close attention. Okay. The first one is about salmon. I spent 5 years on an island in coastal Alaska where I caught sockeye salmon, tagged them, counted them, weighed and measured them, and learned actually how to smoke the sockeye salmon. That's one of our 3 girls. Okay? Identify her in your mind. Second one is about Egypt. I spent a semester in Egypt during college, which was an amazing experience. While there, I received a marriage offer from a sheik. I was 21 years old with long blonde hair, but turned him down since my father didn't have any place for the camels and goats he offered as a bride price. Third one is about concerts. My favorite thing to do when I'm not working is traveling, and I hope to do more of it when I can retire someday. And then some trips before that. I also enjoy concerts and have been to more than 50 concerts. Last concert was Jelly Roll and Post Malone. Does that sound familiar to anyone in this place? Okay. Very good. Did this with my son. It was amazing and fun. Very first concert ever was Tom Jones with my mom in the 70s. Okay, so concerts. Who do you think is the concert girl? Is it Mandy? Is it Kathy? Or is it Ann? Okay. Ann's the concert girl. Absolute. Mindy. No. Kathy. She's your concert girl. Okay. How about Egypt that turned down a sheik? Mindy.
People stand up. Some of us don't know all these people.
That's Mindy. Mindy's the one with the sheik that she could have had.
For real, I got 2 marriage proposals actually.
Oh. And then Ann is your fish girl. So they're going to talk about all the things that we're going to face as it gets cooler weather, colds, flu, COVID, all of that. And hopefully in there they're going to tell us how we can prevent from getting them. So welcome Mindy, Ann, and Kathy.
Thank you all.
all for being here. This is really nice. It's nice to see a big crowd. And that was fun. I didn't know those things about Mindy and Kevin. Okay.
I didn't know you smoked salmon.
Yeah. I have great pictures. Oh, okay. So the name of the presentation is What's the Difference? Colds, Allergies, Influenza, RSV, and COVID-19. So we're going to start with colds. So I'm not going to go over what's up here. You can all read this. If you can't see it well enough, maybe I should just read it out loud. Yeah. So lots of different viruses cause colds. The most common viruses are rhinoviruses, nose viruses, transmitted primarily by droplets in the air, by sneezing and coughing. Also, physical contact with infected persons or contaminated surfaces. That's why it's good to keep cleaning your surfaces and your hands. The viruses can survive for hours on skin and other surfaces. So there's more than 200 types of respiratory viruses. Yeah, more than 200. And they're always present. They always can cause symptoms when the conditions are right. So cold symptoms. Now this is a slide that's sort of by the by. You don't really need to know this. Stuffy runny nose, a cough, kind of feeling bad, tired, sneezing, sore throat. Maybe you can get a low fever. And one thing that differentiates colds from some of the other things we're going to talk about is there aren't any stomach symptoms. It's just respiratory. So, how long does it last? When does it start? How long can you make somebody else sick? So the incubation from the time that you get infected, you sit next to somebody who coughs on you, to the time that you start getting symptoms can be 24 to 72 hours. So 1 to 2 days can lapse between the time that you are infected and you develop symptoms. So the onset, 1 to 2 days. The contagious period is -1 day from your symptom onset, so you may not even know that you're sick yet, and you're already contagious, up to 7 days after you develop symptoms. And the duration of a viral illness with a respiratory virus causing a cold is usually 7 to 10 days. It can be longer. We know that a cough is usually the last thing to really clear up. So you'll have symptoms for a week and a half. And usually it can hang on for longer. Or if you notice that things are going on longer, you can always check in with the clinic or check with your allergy on the allergy reports. So the symptom management for colds, for upper respiratory viruses, for just the fever and the feeling really tired and awful, warm water, warm showers, sleep, lots of fluids. There's something that's over the counter that's black elderberry syrup. Lots of the different pharmacies and have this. There's lots of different products now, but that's antiviral, a mild antiviral. Tastes really good, you can take it. That's something that you can think about. We'll wait until the end for questions if that's okay. And for the fevers and the aches, you can take Tylenol or Advil or aspirin if there's not a contraindication for the aspirin or the other meds. You get a stuffy nose, so the symptom control or symptom management for a stuffy nose, You probably are aware of a saline nasal rinse. That's very good. You can do that 3 times a day and it can be really helpful. You can use a humidifier in your room. That can help reduce the stuffiness in your nose, the dryness in your nose. And as funny as it is, there's research about chicken soup. So yeah, chicken soup. There's a spray you can buy over the counter called Afrin or other names for it that is a topical decongestant that shrinks the swollen nasal passages. You can only use it for 3 days in a row or it causes more problems. And then Sudafed is another medication that's decongestant. You need to talk to your nurse practitioner or your doctor before you start that because it can have interactions with other meds or other conditions. So coughs, what do you do for a cough? Fluid, lots of warm fluids. Cough drops really can be really helpful. There's a lot of over-the-counter cough preparations. Most of them come in syrup and tablets, depending on what you prefer. There's Robitussin or Delsym, and those things have the generic guaifenesin, and that thins the secretions in your chest and your nose, so blowing your nose and coughing works a little better to get rid of the phlegm. So if you're getting something that is a combination medicine like Tylenol PM or Aleve cold and flu or something that's got more than one name on it, then check with your NP, check with your doctor before you start taking that, because you'd like to know what are the medicines that are actually in that. Prevention is the best treatment. So when you cough or sneeze, do that either in a tissue or in your elbow, your bent arm. Wash your hands. Washing. That's really good. Hand sanitizer is a good thing if you're out and you're not able to wash your hands. Try to pay attention and don't touch your face. That's something to kind of keep in mind during the cold and flu season. Try not to be rubbing your eyes, scratching your nose, things like that. Be aware of being in a room with people that are ill and try not to. Try to stay away from them. And wash your hands. So allergies. Allergies are a totally different animal. It's your body's hypersensitivity, so you're oversensitive to a pollen, grasses, or mold spores that your body reacts to with an immune response. So your body sees something that is not part of you and tries to fight it off. And part of that reaction is all the symptoms we think of with allergies. Itchy, runny eyes, sneezing, congestion. So the allergies tend to be seasonal because they're generally caused by plants. So things will bloom or be growing or be flowering at different times. And I know you can check online or in the newspaper about the allergy report, what's up and what's down. So this is, I love this picture. This is a picture of a mountain juniper, or what we call a cedar tree, with all the pollen blowing in the wind. So you know the symptoms. Number one, again, like colds, there's not going to be any gastrointestinal, no tummy symptoms. So if you're getting sick and you're feeling a little sick to your stomach, it's not a cold, it's not allergies. You got to move on to the next ones. So itchy, red, swollen eyes, a scratchy throat, a stuffy, runny nose. You can feel kind of dizzy. Things are getting swollen in your head and it can make you dizzy. You can be really tired, just feel like you don't have any energy. And you can get a cough. There's more postnasal drainage and you can have a cough. So the timing of the allergies, this is a chart and it's in the handout that shows what's blooming when in Central Texas. So usually with allergies, you can be aware that, maybe December through February, you tend to get a runny nose. And you can look at something like this or follow the allergy reports, pollen reports, and find out, okay, I'm probably allergic to cedar. Or depending on when you get symptoms, what you're allergic to. So there's often an uptick in allergy symptoms when there's a change in the weather. There's a lot of wind that comes in from North Texas or from the west. A lot of times people will feel more symptoms then. And the symptoms resolve when the weather changes, when the seasons change. So when it's been cold and dry and suddenly it gets warm and wet, different things are blooming. And hopefully you're not allergic to the next thing. So there's no contagious or incubation period. You're not able to pass this on to anybody else. So the treatment and prevention. First of all, there's over-the-counter medicine that you can buy without a prescription, and those are called antihistamines. And those are pills that all of us know: Benadryl, Allegra, Zyrtec, Claritin. The Benadryl, that the generic name is diphenhydramine, can make you really sleepy. So we kind of tell people, this is not the best drug to take if you're going to have to get up in the middle of the night and do whatever you need to do in the middle of the night, and it might make you a little drowsy and less stable on your feet. So beware of Benadryl. There are eye drops that you can buy over the counter for itchy red eyes, and there are nose sprays that can be prescribed that are particularly for allergies. There's steroids, and these are pills or shots, and they're used to kind of calm down your immune response. It's not the first line of treatment, maybe the second or third line if the first and the second line don't work. So there are pills, there are nose sprays that you can buy that are over the counter, and there are eye drops that are prescription. And then there's going to the allergist or immunotherapy. So these are shots after you get tested, which is kind of a lengthy process for the allergist to find out what are you reacting to and how do we need to mix up your particular medicine. So it takes longer to work, but it can give very good relief. Okay, so that's it for colds and allergies.
Okay, now it's my turn. I have to put my glasses so I can see. Okay, so I'm going to talk about influenza. As most of you probably know, influenza is the same as the flu. It's also a virus infection. It causes seasonal flu, which kind of starts October, November-ish and goes through until like March or April. In the summer, there's usually is no flu. There's influenza A and influenza B, so there's two different types. Sometimes you can get more of the stomach stuff with one kind or another, and usually every year there's like a certain strain that's more predominant, and it can vary from region to region, so we kind of track those a little bit. It's transmitted just like cold by droplets and contaminated surfaces, same thing as a cold. This next upcoming season is supposed to be a bad flu season, partly because we're having lower vaccination rates, and also the H3N2 strain, which is one of the more prevalent strains lately, is supposed to be here, so that means we may have a bad flu season. So make sure y'all get your flu shots. Babies, children, and older adults are higher risk for severe illness. How do I change the name? The arrow. Oh, sorry. Okay, symptoms. So one thing that's different from the flu than like cold or allergies or anything else is usually it just hits you hard and fast. You'll be fine the night before, you go to bed, you wake up the next morning, you are so sick, you feel absolutely terrible. It says here like I've been run over by a bus. It's not just something that kind of sneaks up on you. You maybe have a little bit of a headache, a little runny nose one day, next day maybe feel a little bit worse. The flu is usually not like that. You just feel terrible all of a sudden. You can have muscle aches, cough, stuffy runny nose. Most of the time you don't have a lot of sneezing like you do with cold or allergies, but you can. Fever and chills are very common. Sometimes people can have a really high fever all of a sudden, like they'll wake up 103 fever. Headaches are common, and this will have stomach symptoms some of the time. You get nausea, diarrhea, or just loss of appetite. Basically just want to lay in bed and not do anything. Incubation is 1 to 4 days after exposure. You'll get symptoms. Onset, like I said, is rapid or sudden. It doesn't sneak up on you. Well, I guess it kind of sneaks up on you, but it's not slow sneak. Contagion is day before. So the day you went out and went to eat dinner with a crowd of people, you felt just fine. Next morning you wake up feeling terrible. You were probably contagious the day before. Duration, it lasts about 7 to 10 days. The cough and fatigue, though, are what persists. So sometimes you can, even though all the other symptoms are better and you're feeling better, you still, it takes 2 more weeks for you to get your energy back and feel better. And that's kind of, unfortunately, normal with the flu. Prevention and treatment, vaccine every year. We have trivalent, which means it has 3 different strains in there. They try to predict what's going to be out every year. Sometimes they match it exactly, and the flu shot works great, and you don't get sick. Other years, they don't match it exactly, and so you still might get the flu. But having the flu shot makes you have a much less severe case. So even if you get the flu, you won't be nearly as sick as if you don't get the vaccine at all. Getting a flu shot reduces the risk of needing to seek medical care by 40 to 60%, and you may still go to the clinic, but you wouldn't have to go to the hospital. People who are vaccinated each year have better protection against new strains also, because sometimes we'll have a strain that we never had before, but just getting the flu shot will help you not get as sick. The bad thing about the flu shots is they kind of start to wear off after about 3 months. You still get some protection, but not quite as much. So people who run out and get their flu shot August 1st, it may not last into the beginning of the next year. So we usually do our flu shot clinic end of September, beginning of October, because that way it gets you through most of the worst part of the season, which is like November, December, January, February. If you get it a little bit later, it'll last through that worst part of the season. If you get it in August, it'll still help through most of the season, but the recommendation by the CDC is around October 1st. At least that's what it used to be. I didn't check this year. Last year it was October 1st. Always wash your hands, just like anything else. Like Dan was saying, don't touch your face, stay away from people who are sick, all that good stuff. If you do get the flu and you are sick, the good thing about the flu versus colds is there is actually an antiviral medicine that we can give you that can make you feel better faster and maybe not feel as crummy. The old one is Tamiflu. You've probably all heard of that. There's a new one called Xofluza, which is actually just a one pill treatment. If you are exposed to somebody who has the flu, like you live with somebody, we can give you Tamiflu to try to prevent you from getting sick. So that is also something that we can do with the flu. If you are sick with the flu, the medicine has to be started within 72 hours to be effective. So if you do get flu symptoms, call as soon as you can. Even if it's Friday, call by Monday. That's still within the 72-hour window to try to get somebody to come and see you, diagnose the flu, and get you on some medicine. If you wait after 72 hours, you're just gonna take a little bit longer to get better. You might get a little bit sicker, but you still can do all the supportive care kind of things. So Xofluza is the newest one. It is to treat flu cases and prevent flu after exposure. I think it's a one-time pill to prevent also. It's 2 40-milligram tablets one time. This is nice because it's just one pill, whereas Tamiflu is for 5 days, twice a day. So if this is available and your insurance covers it, it's a little bit easier treatment. You only have to take 2 pills one time. Now this one you have to take within 48 hours of exposure for it to work the best, so within 2 days. So if it was like between 2 days and 3 days, we may tell you we should do Tamiflu. It can be a little bit expensive. If you don't have insurance, it's not covered. It's $175 to $200, but if you are going on a trip and you just want to feel better, you can pay the money and get the Xofluza and get better. But it's supposed to be covered by most Medicare drug plans. So symptom management is kind of similar to everything else. Warm shower, sleep, fluids. This looks almost like the cold one, except it says flu. Elderberry syrup, Tylenol, Advil, stuffy nose, all the same things. So the symptom management is the same. The only difference with the flu is that there is an antiviral medicine we can give you for the flu. The flu is also more contagious than the cold. So how do we know? You come to the clinic and we're like, how do we know if you have the flu or a cold? Well, sometimes it's hard to tell. The things are different. The flu is abrupt onset, hits you fast and hard. The cold is more gradual. You usually get a fever with the flu. Cold, usually you do not. Body aches is very common with the influenza. The cold, you might have a little bit of body aches, but it's usually not as severe. Chills are very common with the flu, not common with the cold. Fatigue and weakness, you always have that pretty much when you have the flu. The cold, you might just feel a little bit under the weather, but you may not feel like totally down and out. Sneezing, sometimes with the flu, very common with the cold. Stuffy nose, very common with the cold. And sore throat, very common with the cold. And the flu, it kind of varies. Chest discomfort and cough, you can have with both of them, but it's usually more severe with the flu. Headache is very common with the flu, and not so much with the cold, except for maybe the sinus congestion sometimes you can get. So sometimes they're very similar symptoms, and it's hard to tell sometimes. That's why we have a flu test, which hopefully helps us diagnose if you have the flu. So the other virus we have that we've heard about more recently is RSV. It spreads kind of like influenza and the cold, same way, droplets, contaminated surfaces. So again, make sure you're washing your hands and staying away from people who are sick, because you don't know what they have, and you don't want any of these things. Generally causes a more mild illness, except in infants and older adults. So kind of feels just like a cold. It's more seasonal, late fall through early winter, but same time that we have flu, and cold season is kind of then too. Most people that have RSV think they just have a cold. Older people are more susceptible to getting more sick, and it does sometimes kill older adults. It causes a lot of hospitalizations among older adults. You may have heard about RSV with babies. This is a big problem for babies. They can get really sick. They can end up in the hospital. The vaccine, I think, initially was being developed for them, but now they found that it works for older adults too. There is a test that you can detect RSV, but there really isn't any special treatment for it, and it doesn't really change how we manage you. So we don't have the test. A lot of places don't have the RSV test because we're really not going to do anything different with it. So RSV symptoms should all look very familiar to the other things. Stuffy, runny nose, cough, congestion, headache, sore throat, mild fever, fatigue, just like the cold. Incubation time 2 to 8 days. Onset is more gradual like the cold. It's contagious a day before to up to 8 days after, and it usually lasts 3 to 7 days. So one thing that's different, this one may not last quite as long as cold or flu. Symptoms, these all look very familiar. Same things. Treat the symptoms, try to help yourself feel better, cough medicine, something for the stuffy nose, all of that good stuff. So there is no cure or antiviral medication for RSV. You just treat the symptoms, just like a common cold. Prevention is also the key for this. Wash your hands, avoid people, especially this disease you don't want to give to infants. Now, you don't want to make anybody sick anyway. So if you're sick, stay home, stay away from people. But if you may not know you have RSV, but if you have cold symptoms, stay away from babies just in case. The CDC did approve a vaccine for RSV, and it's available for adults over 60, and we've had it since June 2023. We did a vaccine clinic here, I think it was with COVID, and they did RSV, and so a lot of you may have gotten this vaccine. It's not a every year vaccine like flu, and COVID's probably gonna be, but I think now they're saying every 2 years. You can get it at the same time as other vaccines. Most pharmacies have this, and it's better covered under Medicare Part D. When it first came out, it wasn't so much, and it was a little bit expensive, $175 to $395. So if you didn't get it back in the day because it was too expensive, it might be covered now, and it might be a little less expensive. And it is a good idea to get this too, so that you aren't one of the people that end up in the hospital with RSV. It's a one-time dose before the season starts usually, so it's kind of like along the lines when the flu shots are given. This is not an annual vaccine. There are 3 different ones available now. It reduces the risk for moderate disease by 78%, that's pretty good, and for severe disease by 86%. So it really decreases your chance of getting really sick from it. People who are more at risk are anybody with heart or lung diseases. And the side effects of this vaccine are very similar to the other vaccines. So there's no serious adverse effects. So it's a good idea to get this one if you can. All right, now Mindy's going to do COVID-19.
Okay, COVID, our old friend now. I remember back in the day when it was new and exciting, and now it's just the same old, same old. So I used to have a slide about the history of COVID. We don't need that anymore because we lived it. So I took that out. So what's happening right now, we're still seeing outbreaks several times a year, still 2 to 3 times a year. We tend to have these spikes. It kind of depends on the place. Fewer people are having severe illness compared to the original variant, in part because we're developing natural immunity and so many people are vaccinated, but also because the virus has mutated to where it is much more contagious, but doesn't cause nearly as severe illness. We're hoping eventually this will be a seasonal vaccine, a seasonal illness like the flu. It is not yet, but apparently it can take anywhere from 10 to 15 to 20 years with a new virus like this before it kind of settles in. So we've still got a little ways to go. We don't have good information about levels of infection, and the reason we want that is to know how risky is it to be out in crowds right now. We don't have a lot of good information because we're not reporting anymore. What they're doing is they're checking a viral load in wastewater, which gives you, when you see that upticking, then you can say there's a lot more people who have this virus right now. And then the rate of hospital admissions, because it's going to be listed on the reason why they come in, and people are still being tested if they have upper respiratory symptoms. The predominant variants, if you care, are NB1.8.1, which they're calling Nimbus. You may have heard of it because people are saying it has the razor blade throat, which is really dramatic. But apparently it's just a bad sore throat. And then LP8.1. But we're not really tracking this as much anymore, most of us, because it's evolving so rapidly. Several times a year, then we swing from what's predominant and now another strain. They're all, though, right now, everything that's predominant comes from that Omicron, if you remember that, started in like 2022. These are all the great-great-great-great-great-great-grandchildren of Omicron that are causing us trouble. The CDC made some changes in vaccination recommendations for healthy children and pregnant women. That doesn't really apply to most of us, so it's pretty much the same for adults. This is going to be very familiar. COVID can seem a lot like the flu. The things that are different generally are, some people can develop shortness of breath or difficulty breathing and have lower oxygen levels. That's with more severe illness. That's typically not something you see with the flu unless you get a pneumonia because of the flu. Lots of fatigue, nausea, vomiting. People have more of a tendency to lose their sense of taste and smell. The last time I had COVID, I put vinegar in my hand and licked it, and I couldn't taste it at all. It was kind of weird. It goes away once you recover from the disease, I'm happy to report. Some people get a thing they were calling COVID toes at one point. Can be a rash or nodules on your toes. The severity of symptoms can be anything from you feel kind of crummy, you feel a little under the weather, like a cold for a day or two, all the way to people being hospitalized and in the ICU. There's a big range. Of course, if you're vaccinated, your chances of not being in the hospital are a lot better. Incubation period, this is part of the problem with COVID. It's very long. You notice for the other illnesses we were talking a few days. This is even up to 2 weeks that you can have the virus, not know you have it while it is silently growing inside of you. And so you can spread that starting 1 to 2 days before you even have symptoms, but up to 10 to 20 days after recovery. Usually the onset is gradual, so not necessarily hit with a freight train like with the flu, but that also kind of varies. And then how long does it last? Usually, now I have 7 to 14 days here. It's kind of shortened with the vaccine and the kind of weaker virus, so sometimes people are only sick for 5 days. But it can be prolonged. And then there is long COVID, which is fabulous. Where these symptoms can go on for weeks or even months, and now even years, unfortunately. So the way that it spreads is basically the same as everything else that we're talking about. COVID at first they said was spread by droplets, so that's when you cough and sneeze and it's a little bit bigger particles. They have found that COVID likes to become aerosolized, which means it's in tiny little particles. It can just be hanging around in the air. It can be circulated in your ventilation system, and that's part of the reason it spreads so quickly, besides being new, is for that reason. So we want to try and stay away from people if they have COVID. We know they have it, if we can. Direct contact, not as much of a problem with COVID as we initially thought, but we're still going to be cleaning services and making sure we're washing our hands. It is more contagious than the flu. It is very contagious, and like I said, the newer variants keep getting more and more contagious, and it just spreads around really quickly, unfortunately. Another unfortunate people at higher risk for severe illness are going to be people 65 and older. People are immune compromised. That might be because of a disease or because of medication you have to take. There are lots of chronic illnesses, particularly those that affect the heart and lungs, and also diabetes that can cause you to have more severe illness. Obesity is also a risk factor for severe illness, pregnancy, and then of course if you're unvaccinated, you are at the highest risk to have severe illness. I tried to find some rates about unvaccinated folks, and the CDC website's a little under construction right now, so I couldn't quite find information I was looking for. There's a whole lot of possible complications. We're really not seeing this as much now. The newer viruses are not making people as sick. We've got a lot of immunity and vaccines, but still one of the more common things is people will develop blood clots, and that blood clot can cause a stroke or a pulmonary embolism because of the effect the virus has on our clotting system in our body. And then there's our friend long COVID. So that can be fatigue or brain fog, but for some people, they're short of breath, like going up a short flight of stairs will make them short of breath, and then an ongoing cough that that can last a really long time. And right now, the last number I saw was about 7% of all adults who've gotten COVID have developed long COVID. That's 14 million people. That's a lot of people. Some people get over it and then don't have it anymore. Some people are still living with it now, unfortunately. And long COVID can happen. It doesn't come about because you had real severe illness. You can have a really mild case, like I would not even have known I was sick except I tested because my husband had it, and you can still get long COVID. You know what helps keep you from getting long COVID? The vaccine. So here's some numbers just looking at, everybody now will say, COVID is just like the flu now. Yes, a little bit in some ways. We can see here, I'm going to just make a disclaimer that again, the information coming from the CDC right now can be difficult to verify, and so I'm reporting it, but we'll take it with a little grain of salt. We still saw a lot more flu than COVID last year. Also, we're not tracking in the same way, so we'll take that under advisement. But as you can see, for flu, there were more than 27,000 deaths. But from COVID, we saw 35 to 54,000 in the same time period. We did have a worse flu season last year, in part because people aren't getting vaccinated in the same rate. So we had a lot more flu last year than we did 2023 to 2024. Most COVID deaths still occur in older adults, so there's still high risk there. We have the data issues. So here's the treatments. I'm not going to read all of that. This did not change from last year. Honestly, really the only treatments they're giving right now are going to be the Paxlovid, which is an antiviral which specifically targets COVID. We're using it for people who are high risk. You start it within 5 days of symptom onset, so you have a few more days than the flu medication. And it's twice a day. It's either 3 pills or 2 pills, depending on your kidney function, twice a day for 5 days. Now, unfortunately, it has a lot of interactions with a lot of medications. So not everyone is a candidate. If you take a blood thinner, you can't take Paxlovid at the same time because it can cause bleeding. So it's something you'll have to have a conversation with your nurse practitioner or your doctor about if you get COVID, about whether you're a candidate for Paxlovid, but it is very effective in preventing severe illness and hospitalizations, which is great. Let's see, we're not going to talk about rebound COVID, it's not interesting anymore. And then the second one there, the molnupiravir, they're not recommending anymore. That's another antiviral for people who can't take Paxlovid. It doesn't have all the same interactions. Also, it's barely effective, so they're not really recommending it. If you're fully vaccinated, it's really not shown to give you much benefit at all. Someone who's not vaccinated, however, might benefit from it more. And then there's remdesivir, which is an IV antiviral medication, but you have to be in a facility, you have to be monitored, it's given by IV. Really not using it that much except in the hospital for people who are really severely ill. And convalescent plasma seemed like a good idea. Turned out maybe not such a great idea. Doesn't really work very well. It's really hard to get anymore, and nobody's really recommending it. Symptom management, this is all going to be real familiar at this time. For your fever and aches and your stuffy noses, that's all basically the same. The one thing about the symptom management is if you develop shortness of breath, you need to tell your provider immediately. And sometimes people who develop breathing issues when they have COVID are put on oral steroids. Dexamethasone is the most popular. To kind of help you get through that part of it. Vaccination is the best treatment. So the vaccines we have right now, even though we've had all this mutation, are still effective. However, they are working on a new formulation for 2025, 2026. We'll get to that in a second. Unfortunately, because of the way the virus has mutated, the vaccines originally were really, really great, 94 to 95% reduction in people getting sick at all, getting symptomatic illness at all. We are nowhere near that now. It's more like 50 to 70% right after you have a booster, but then that decreases and decreases as time goes on. So the virus has mutated to get around our immune system and squeak around the vaccine too. So more people are getting symptomatic COVID, but again, it is not severe in most cases anymore if you are vaccinated. We still have really good protection against severe disease, meaning hospitalization and death. So it is 85 to 90% effective after a booster in preventing severe disease. That also wanes down to about 50% over 6 months, which is why we've been getting boosters about every 6 months right now. We're hoping that'll change, but it hasn't changed yet. Moderna just got approval for an updated vaccine that's going to target one of the new variants. There's a few other changes on it that are technical that I didn't really understand because I am not a virologist. And it is a little bit more efficacious for older folks in preventing disease. However, it is not yet available. So it was approved in June, but I could not find anywhere, not even on the Moderna website, when it may be available. So, in theory, that was supposed to happen in September. It's kind of not looking like it. We're almost to August, so we'll have to wait and see. I don't know if they'll have us do another booster of the 2024 to 2025 versions that are still available. They may end up doing that if they can't get it out soon. So again, the updated vaccines are not available yet. Vaccine side effects, we've talked about this, pretty much the same as everything else. There have been a few more serious but really, really rare side effects with the COVID vaccine. Most of those occur with adolescents or young adults. However, your risk of having severe illness far outweighs the risk of one of these severe side effects. But those are myocarditis and pericarditis is what they've seen particularly in young males. So we have 3 choices right now. There's Pfizer and Moderna. Those are the mRNA vaccines. Those are the new ones they developed during COVID, extremely effective. And then we have Novavax, which is more of a traditional vaccine in the way that it's developed. It is not as effective. It also doesn't need the special handling and cold and things that the other 2 do, so it's still something that's needed, especially in other parts of the world. This right here is the schedule for people who have not been vaccinated. If you've been vaccinated, we're on the booster schedule. Whenever they tell us to do it, we'll be ready to go. How long are we going to need boosters? No idea. That's a lot of words to say no idea. Probably ongoing, just like the flu from here on out. They are working on a combination flu COVID shot that we also don't have yet, which would be nice, 1 shot instead of 2. The nice thing about these mRNA vaccines, that's that new type of vaccine, they can be modified much more quickly than traditional vaccines. So we're talking about making the modifications and going into production in months as opposed to years. So that does bode well for the future. So I put a few questions here to answer for you, and then we can take some questions. So how do I know what kind of infection I have and how to treat it? Because everything I said sounded the same for pretty much all of those things, Mindy. How am I supposed to know? Come on down to the clinic. If you're in assisted living or healthcare, I will come to you. They will also come to your apartment if you're severely ill and can't get out. And we can do some testing, and then we can also, by your symptoms, with the experience that these ladies have, sometimes you can kind of figure it out based on what you tell us, even if our test doesn't help us very much. Can you get a COVID and flu vaccine on the same day? Yes, you can. We don't typically here do our flu vaccine clinics the same day as COVID, but if you go to the pharmacy, you can get them both in the same day. So I just answered number 3, where can I get the vaccines? The wellness clinic will have a flu clinic. Usually we do that over 3 different days, but you can sign up for in the clinic. And we will give you your flu shots here. It's very convenient and easy. We do not have the dates yet. We don't have the flu vaccine yet either. But there will be lots of announcements once we do. It will be hard to miss. And typically whenever there's a new booster recommendation, Terrytown comes out and they'll do a COVID booster clinic. And again, Robin's really good at getting that information out to everybody. Where can I get an RSV vaccine? We do not have that, we can't give that, so you just go to any local pharmacy, they can give that to you. All right, that was a lot of talking from me. Does anybody have a question? I see way in the back, Debbie.
I have always gotten, can you hear me?
Yes.
I have always gotten the Pfizer vaccines. But you just said that Moderna is coming out with a newer one. Now, can I change to Moderna?
Absolutely. With the information that we have, with the original series, they said try to stay with the same. If you started with Moderna, try to stay with Moderna. If you started with Pfizer, stay with Pfizer. Now with the boosters, that's not the recommendation. Get whatever one you can. So if you've had all Pfizer to this point, and the Moderna is the one that comes up with the new, better updated back booster, then that's what you can get. And there's not gonna be any problem as far as it won't be as effective or anything like that.
Are they coming here for that?
We don't have any information yet. Once they make a recommendation about when we should have these boosters and it's available, Terrytown will do a clinic here and it'll be available. I think there was someone right up here, Demi. Oh, she's got a microphone. There we go.
You spoke of elderberry syrup. What about elderberry tea?
Yeah, I'm not sure about that. I would imagine there's a small amount of the active ingredient in the syrup that's also in the tea, but the tea is gonna be a lot less concentrated than the syrup.
I'm thinking more prevention than cure.
Yeah, take it as a tonic to kind of help yourself stay away from viruses. I think that sounds reasonable.
If you're not sure when you had your RSV vaccine, any downside in going ahead and getting one this year?
Not that's been documented. There's really not going to be, it's not necessarily going to offer you any additional protection, but you really shouldn't have any kind of a negative side effect from that. The same is true for your flu vaccine. If you got it September 15th and totally forgot and then get it again in January, nothing terrible happens. Yes, sir.
Yes, Ann talked about the life of a germ, and I'm curious, we use a lot of equipment here in the phys ed program, a lot, and as far as I know, nobody's cleaning it. And so I'm wondering how long, if you're using 40-pound weights are used by everybody, and some of the lighter ones as well. So how long are they effectively able to give a disease?
That probably varies depending on the virus. I mean, usually you're talking about hours, not necessarily. These are things that need a host to survive and replicate. So usually you're talking about hours. I'm sure there is a cleaning schedule. I don't know what it is. Robin might know that. But the main thing is going to be if you're using a common area and common equipment, wash your hands when you're done. Try not to touch your face or your eyes. Or you can use hand sanitizer in between. I know a lot of gyms, they have you bring a thing and kind of wipe it down. I don't know how much good that really does. But it's not really, none of these things are really shown to predominantly be spread by that kind of contact. It is possible, but Not if it's probably been sitting there for a few hours. It's not likely at that point that you would be able to get an active infection from it.
I took the booster about a month after it was given here. So, should I just go ahead and take the next one when it comes out with it? And I lost track of what the timing on that.
Sure. So at first they were saying if you've had COVID or you had a booster, then wait 90 days before you get the next one. At this point, they're not recommending that. There has to be a certain time in between. I think the thing is that we do know that your protection against hospitalization and death drops down right now to about 50% after 6 months. So we don't want you going, if you stay sort of within that 6 months, give or take a month, you're fine. You're fine. Any other questions? Thank you very much for showing up and staying awake. Appreciate it. I'm glad I didn't marry in a shake and stay in Egypt. Oh, never mind. We had some handouts and they may have been gone, so if you end up wanting one,
There'll be some in the clinic.
there will be some in the clinic. We'll print some more and have them ready for you at the clinic. You can stop by anytime.
Well done.